New information on a story we broke here on News West 9 last night. A billing error is costing Midland Memorial Hospital, and we're talking more than $500,000. Essentially what happened, Midland Memorial claimed reimbursement for patients who were treated for COVID or got a vaccine, but those patients didn't have COVID at all. News West 9's Rachel Ripp is on the story tonight. Rachel, what did you find out?
Well, Crystal, first and foremost, it's important to note that this happened back in November of 2020. Now, according to the Office of Inspector General, it was self-reported by the hospital, by Midland Memorial. Now, as for the hospital, they tell me that their billing system is pretty complicated. The mistake can lie in mistyping a code into a computer. This is reality for Midland Memorial Hospital last November when 87 miscoded and uninsured COVID-19 patients never actually had the virus. The result? More reimbursement money from the federal government, specifically a branch of Health and Human Services called the Health Resources and Services Administration.
What used to be a big stack of paper is now a computer-generated record, and then it takes that clinical information, moves it over to a patient billing information where it is coded by expert coders. The bills are sent typically electronically to whatever payer is appropriate for that patient.
The expert coders actually work for the hospital, but off-site.
Expert coders look at what happened clinically, what's been documented, and turn that into a coded bill. And those codes dictate what will be paid by the payer. Sometimes the payers challenge those. Sometimes they have other reasons why they don't want to pay us, or they pay us differently from what we expect.
Now we know how the system works. So what was the detailed problem? Well, the hospital CEO tells me the sequencing of coding is different for insured COVID patients compared to those uninsured.
The way that HRSA wanted us to code COVID positive self-paid patients was different than we would have done for anyone else.
Instead of listing another condition before COVID like they typically do, HRSA requires them to list COVID first. Well, the coding got mixed up and wasn't recorded accurately. 20 to 25% of COVID patients are uninsured who get service from the hospital, and that's the group that was affected by the miscoding.
Those can be carefully scrutinized now by the leadership in our revenue cycle departments, so that we're having multiple different eyes on the coding and making sure that they're accurately coded before those bills go out.
Now, a few months after those coding errors were first discovered, the hospital recruited their third-party auditor who typically reviews their billing work and is having them look at 100% of the COVID claims. That's still in effect today. Reporting live in Midland, I'm Rachel Ripp. Back to you.